Now, there are a lot of reasons to come to this conference. You want to come for education, you want to come for collegiality, you want to come for the CEUs. Some people, believe it or not, want to come for the food. But how many people think coming to a conference like this, sitting here in a lecture hall, being entertained by people like me and the other speakers, eating some food, drinking some coffee, is a much less stressful thing than going to your workplace? The only people that didn't raise their hand are people that are sitting next to their supervisors. All right, so one of the things that I've been very interested in for a while is stress, and how stress manifests itself in terms of your health and specifically your heart. And so a couple of years ago I decided to go kind of surreptitiously and investigate what stress looks like without somebody really knowing whether they're being monitored or not. So I put these hidden cameras throughout the Health First organization. Some of you may actually be on that. So anybody here work at the Health First Health Plan? Good. And so I decided, rather than go to the most obvious stressful places within our organization, the ICU and ER and places like that, I thought I'd go to the Health First Health Plan. I planted this hidden camera, and it's going to be the video we're going to show you next. So here's one of the associates. This is the guy we're going to keep our eye on. And he is in the middle of processing EOBs. Well, EOBs are little claims forms for insurance. And he's printing the document. And so he goes, sends the document print command, he's waiting for it to print, comes out, and nothing. So he goes back, sends the print command, walks back to the printer, and waits for the printing document. Here it comes again, looks at it, it is blank. He goes, I can fix this, I'm not going to call IT. Bam! Toner all over his shirt. It's not starting off as a good day. I'm going to find a different way to print this document. I push that copy button, the better it works. Well, the other thing. Working at the health. It's not working. But it is an example of stress. And you never know where stress is going to come. And so really the key to stress, if I'm going to kind of condense my presentation into one or two words, is how you handle the stress. Well, it seems a little bit of a paradox that on Valentine's Day we're talking about broken heart syndrome. But it really is kind of very relevant for a couple of reasons. Number one, it's by no coincidence that February is the American Heart Association's Heart Month. But I think if you'll let me become smarmy for just a second, American Greetings and Hallmark would want you to say that you really can't know love until you understand the broken heart. So we're going to talk a little bit about broken heart syndrome, and maybe you'll get a little bit of understanding of love from that. All right, broken heart syndrome. It's also known as Takotsubo syndrome. Takotsubo, as you might imagine, is a Japanese term, and it comes from the name of the octopus pot that Japanese fishermen used to catch octopuses, or octopi. And so the way an octopus is caught in Japan is that a Japanese fisherman in his boat has all of these little clay pots, and he puts them on a string, and the pots descend to the bottom of the seabed, and for some reason the octopus is attracted to the opening of the pot, and they go inside and seek shelter, and maybe they look for food, I don't know what. He comes back later and he pulls the pots up and he finds a bunch of octopus, and he goes and sells them. And so the name of the pot, not the Japanese name for octopus, and it's certainly not the name of the Japanese doctor that described it, is Takotsubo. And this is what the pot looks like. This is a real pot, and this is what the left ventriculogram in our patient, or any other patient that has Takotsubo, looks like. And so the relationship is, the eponym comes from the fact that the left ventriculogram looks like the Japanese octopus pot. Okay, I'm going to stop there and go with any questions. So, thank you very much.